Hello everyone, am I audible and visible? Let me know. Let me check. Am I audible? Am I audible and visible? Am I audible properly? Yes. Am I audible properly? Am I audible and visible? Okay, let us continue. Hello everyone, welcome to Unacademy Future Doctors. Today we will be having a strategy session for how to prepare for first MBBS university examination in last 1 month. Okay? I myself, Dr. Dipti. I'm ND PhD Physiology. I'm Associate Professor and educating MBBS and MD students. I have more than 17 years of teaching experience. Now, let me explain about our subscription. We have two varieties of subscription, Plus subscription and Iconic subscription. In Plus subscription, you can choose the best from the best. Here, you can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access Question Bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes, and within 12 months and above subscription, we are coming with our printed notes. Second one, that is Iconic subscription. Here you have access to the best from two of the best. Which are these two? One that is Unacademy and Prep Ladder with Unacademy, and second one that is Unacademy and Prep Ladder with Prep Ladder. Here, in first subscription, you have well-structured live batches, recorded classes which covers full syllabus. You can have question bank with more than 25,000 questions. You can compete in the live test as well as quizzes, comprehensive printed and digital notes. Whereas in second one, that is in Unacademy and Prep Ladder with Prep Ladder, here you can have clinical and integrated essentials. You can have video lectures from the dream team. You can have question bank 3 with active guidance, rapid revision and snapshots, treasures in 2021 dream notes. So you can subscribe from your mobile. You can have either plus subscription or iconic subscription. You can use my promo code, that is DIPTI10, and you can get 10% extra discount on each subscription. So now let us start with our today's topic. As we all know that your university exams are within a month, and some students they have university exams in less than 1 month. So students they get panic, they get depressed, and because of this situation of depression, that ultimately deteriorates the performance of student. And so first of all, assure yourself that everything will be fine. As said that all is well. Okay? Because it is our mind that can make everything well if you think that all is well. Okay? So you will definitely get good results. You will definitely pass your MBBS with good marks. So first of all, you just have to set your mind for the same. Okay. Now you can see here this year because of COVID, the situation of studies they are very much different than regular years. Okay. Because COVID it came, which happens once in 100 years. And it has definitely affected studies of all the students, not only you, but all the studies of all the students, school studies as well as college studies, they are affected. Okay? Physical, or you can say offline education, is replaced with the online education. Okay? Previously, what happens before exams? Students, they are in the group, they are sitting together and they are talking with each other, that you just read one topic and I will listen the same and I can easily write down in the exam. You just tell me 4 5 points about this topic. Okay? Like that. And they can also easily pass the exams also. But nowadays the situations are quite different, and all of you have not faced, none of you have faced the situation, as well as your seniors also. I think your seniors also never faced such kind of situation. So they also cannot guide you properly. So here I tried in this video to solve the problem which is faced by you people. You can say COVID batch people. Okay. As we all know that you all will pass your MBBS. Whatever MBBS, if you are in first, second, or third prof, you will pass your MBBS. But what is important at present is before exams, how you are managing your stress. Okay? And if you are managing your stress properly, then and then only you can improve your result. This is the main thing at present which is important. Okay? So, how to manage stress during this last month? Okay? We have certain strategies and we have certain, you can say, points that if you are keeping in mind, then you will definitely reduce the exam stress. Okay, let us discuss now. So, first of all, today we'll make a schedule and we'll try to stuck it, follow it, and we will try to study with relaxed mind for better results. Here we will discuss, first of all, we will discuss some points before discussing about the strategy. Okay, now, which are the some points we are going to discuss today? They are, first of all, starting with anatomy. Okay, let us start with anatomy because anatomy is the subject all the students they are reading highest during first MBBS. But still, all the students they feel that they don't remember anything in anatomy. So now, what to do so that you can easily prepare anatomy? You can feel that now I am fine. I can read. I can write down properly in the exams. Okay? So here are some of the best tips. First of all, in anatomy, if you want to remember things easily, you must have to make diagrams. Whatever you learn or whatever diagrams you find in the books, you just try to remember, try to draw those diagrams. Suppose brachial plexus, draw the diagram. Okay, here. Suppose this is brachial plexus. So try to remember it in the form of a diagram only. It becomes easy for you to remember. Okay, that is one thing. Second thing is, if you are drawing the diagram in the exams, that becomes easy for the examiner also to examine the question. So, and when it becomes easy for the examiner, you can gain good marks. So that is second benefit. Okay? So practice making diagrams. And another important thing is, whenever you are making diagrams, always try to write down all the informations in the diagram. So what happens whenever you are just recalling the same, you are just reading the same diagram, what happens? You can easily find out all those information. You can easily recall all the information. Okay? So this is the first tip. Second thing, that is, whenever or whatever you are reading, first suppose today you are reading one topic. So whenever you are reading this topic, today this topic is completely understood by you. So what happens at that time? Because today I know the topic highest, I know highest things about the topic. So what I can do is, you just can note down some important points if you find them. Okay? Either you can make your notes separately or you can write down along with your book, in your book, just as a point. Okay? So what happens? How will it be helpful? At the time of exams, whenever you are reading, that will be helpful to recall all the things which you read at first time. Okay? So this is second tip. Another important point to be kept in mind, that is very important thing. At night, before going to bed, instead of surfing or chatting on the mobile, just try to recall the topic, what you have read today. For example, suppose you read 5 topics today, from which 2 topics you found difficult. So what you should do is, at the time of uh, just before going to sleep, try to recall, or try to uh, just you can watch also those diagrams. Try to recall those topics. Now, it is also, what is the benefit of it? That is, it is also scientifically proven that whatever you recall before going to sleep, it remains stored in your brain for a long period of time. So that will be beneficial for you also. This is another point kept in mind. Next thing is, give priority to the topic. Now, what does it mean? Sometimes what happens? You just open the textbook and start reading from the first page. In the first page, sometimes basic things are given, like functional anatomy and all. That might not be that much important, and you have read those topics for so many times. Okay, so what happens initially, you are reading the topics with enthusiasm. Okay? And later on, at the end of the chapter, when clinical application or applied aspect topics are given, either you have lost your interest or you don't have time to complete those topics. So what happens every time? Those important topics of clinical application and applied aspects, they are left. So what is the solution for this is, always try to prepare the topic according to weightage of the topic in the exams. Suppose today I am reading one chapter of any system like CNS. Okay, so just I have to go through various university papers before that. From this chapter, which questions are frequently asked? Okay, suppose today I'm going to discuss, or I'm going to read one topic of CNS, and I found that this topic, like basal ganglia, it was asked 5 times in previous university papers. So I could get the idea that this is important, and I will prepare it first and with priority. This is also another important thing that you should keep in mind. Okay? This is the mistake done by so many students, and because of that, they are lagging in the mark. Another important thing you can do is, if suppose sometimes some topics are common in 2 subjects. So what can we do is, we can prepare those topic in one subject only. For example, neuroanatomy topics and CNS physiology topics are common so many times. Like thalamus, functional anatomy of thalamus, nuclei of thalamus, we are teaching in physiology also. Basal ganglia, hypothalamus nuclei. Okay, so many clinical aspects of basal ganglia, hypothalamus, tracks also. They all you are learning in anatomy as well as in physiology. So what you can do is, you can prepare the topic nicely in one of the subject. Suppose you have prepared topic of tracks in the physiology properly, then you need not to read the topic again at the time of anatomy. So that saves your time. You can get extra time for reading other topics. Okay, so this is another important thing which you can keep in mind. Okay, now next thing is, now so this is all about anatomy. We have discussed some things. Next is physiology. Okay, now physiology also, flow charts are very important. So if you are remembering, if you are reading in the form of flow charts, it will be very easy for you to remember, and it becomes very easy for the examiner to examine. And if it becomes easy for the examiner, then definitely you will get good marks. Okay, if it becomes easy for me, I'll be happy if I am examiner. Okay, and I can give good marks. So same thing is for all the examiners. Now, next, most common confusion for physiology, because I am physiology person, so I can say that common confusion for students is, madam, which book is to be used, which book to read at the time of exams. Okay, now, so let us try to solve this question also. So if you are reading Guyton, that is a standard textbook for medical physiology, then it is great, no tension. But what is the problem with Guyton is last moment, the student, they cannot gain or they cannot retain things from the Guyton sometimes. Okay, so they cannot be able to write down properly like the students, those who have prepared from the Indian author books. Hmm? Like Indian author books, most of the students, I should not give the name, but the book students are using, one of the book is not very reputed. I don't want to give name. Okay? But suppose you have read from that book. Now what to do? In some of the colleges, they are not giving marks if you have written from that particular book. Okay? I don't want to give name now. So suppose you have read from the Indian author book. Then what is the solution? I suggest you draw the diagram from the Guyton, flow charts, diagrams. Okay? Whatever book you are reading, use the language of that book. But diagrams you should take from the Guyton. That is one. Second, normal values like RBC count, WBC count, hemoglobin. So many other normal values are there. So all the normal values you preferably take from the standard textbook. So what happens in the exam? Suppose your text is from Indian author book, but your diagram is from Guyton. So your examiner feels that no, the student must have read the Guyton. So this is the easy way for you to get good marks. That follow flow charts and diagrams from the standard textbooks. Otherwise, whatever book you are reading, that is fine. Now, because in last month you cannot change the book, that is not possible for anyone. Next thing is, next we come to biochemistry. So here, biochemistry, I think most of students, they feel that it is the most difficult subject, but it is not so. Biochemistry also, you can prepare flowcharts, as many as possible. Okay, cycles, different cycles, flow charts, normal values. Okay, so make a copy of normal values like normal requirement of some vitamins, some nutrients. Huh? What are the normal values? You make this copies. Okay, so that becomes easy for you to remember. So now, common points for all the three subjects. You can note down these points also. Number one, that is make flow charts, diagrams, and your own notes. For one. Second thing, revise them before going to bed. Suppose today you have read 10 topics and from which 3 topics are very difficult. So at least revise those 3. Okay. Third thing, very important one, that is, we will discuss also. Try to write down clinical aspects in your notes in each and every topic. Very important thing here. And learn with understanding without worried about exams. Now I'll explain why there is importance of clinical aspects writing in the exams. Okay, suppose any of the topic you are reading, or you have been given a question, you have a question, that write down this thing, like write down about the this coronary circulation. So always include clinical aspects. Like if suppose your question is coronary circulation, then write down angina pectoralis, write down myocardial infarction. Now, what is the significance? What is the advantage if you are writing down this? Number one is you can score good marks. At least write down 2 to 3 points, 1 point, whatever point you know about the clinical aspects. Okay. So one thing is because examiner feels that yes, the student has clinical knowledge also. Second important thing is because you're going to become clinician. So if you can easily correlate your topic with the clinical aspect, that is great, and that will be useful to you in your clinical practice also. Okay? So always try to correlate your topic with the clinical aspect. So whatever is your question, try to write down 2 to 3 points regarding clinical aspect. Okay? Next one. Now we come to strategy. So how to prepare strategy? So first of all, first and foremost thing is make a list of important topics in each and every subject. It is not very difficult. You can give 1 hour and you can do this. For example, you make a list of topics. Suppose you find 150 topics in anatomy, 150 topics in physiology, important, and 150 topics in biochemistry. It is not same. Sometimes this may have 180, this may have 180, this may have 120. Okay. So suppose you find that you have this many topics and suppose you find that you have time of 30 days. Now what to do is easy. You can read, you can see here, you can read 5 topics of anatomy, 5 of physiology, and 5 of biochemistry daily. So you make a timetable accordingly first. Okay. So suppose today you have started, today make a list of topics. Suppose you found 150 topics, then you can divide them in such a way it becomes easy for you to prepare. Suppose if I tell you to write down about or to read about 100 topics in 3 days, that is difficult. But if you have make a timetable properly, then it becomes easy for you. So 5 topics of each subject per day. It takes, suppose this 5 topics, it requires 3 to 4 hours. This requires 3 to 4 hours. This again requires 3 to 4 hours. So around 12 to 13 hours a day reading completes your syllabus easily. And this is must required before 1 month of exam, as I feel. Okay, now for each and every topic, how to prepare, that we have already discussed. Prepare topic, how to prepare topic, that make flow charts, we have discussed. Sorry, make flow charts. Suppose today you have taken a topic of cardiac output, okay, in the physiology. So first prepare it in such a way that it becomes easy for you. So make a flow charts, okay. Then diagrams, your notes, okay. And before going to bed, just recall the topic. This is the thing you keep in mind. Okay. Another thing also that improves your learning is through YouTube videos. This is a blessing for you. You can watch the video of the particular topic. That will be very much helpful for you. Okay. It is not like that. I'm not telling you for my my advertisement or anything, but it will be helpful to you in your exams very much. Okay. So that is that. So stop worrying about exams, focus on all the strategies, and you can definitely score good marks in your university exams. Okay. Thank you. If you like the video, like it, share with your friends and family members, and you can subscribe our channel Unacademy Future Doctors. Thank you.